We're talking Medicare and health insurance. Catherine CVA from AARP, Steve Edmonds from Alliance Insurance Services. Real quick, Catherine, you said it's 8 months once you have credible insurance with Part B?
Once you retire and you've had Part B with or you've been using your insurance plan to cover your Part B, you have 8 months to sign up for Part B, or you start that 10% penalty we're talking about, and that is for a lifetime.
Okay, 8 months. Steve, this person says, I delayed Part B. I had coverage from my employer's plan. I think now that I'm taking Part B, I'm being overcharged. What do I do?
Okay, so if you're being overcharged, the federal government is probably going by your last year's, your last year's tax records. So what you can do is you can contact Social Security and you can appeal that, and they will go back and look at maybe last year and maybe the year before that and maybe even the year before that, so that they can see, okay, maybe you made a really high income last year, but 2 years ago you didn't. And a lot of times they will change that, but you've got to go through Social Security and ask for that and ask for an appeal.
Okay. Catherine, this person says, I'm a veteran. My health care is through the VA. Why should I even sign up for Medicare?
Because Medicare and the Veterans Administration coordinate care together, and the VA actually uses some of your Medicare benefits to pay for that. So you need to have both. You won't have to do anything. They figure that out behind the scenes, but you do need to give them your numbers.
All right, Steve, this person says, my husband has an HSA account through work. We both turned 65 and we're told to hold off on getting Medicare. Is this true?
I can't imagine why you would be told that. I mean, like we've covered thoroughly tonight, you really need to sign up at age 65 to avoid penalties. Of course, if you have an HSA, they may tell you can't use the HSA once you go on Medicare. I don't know if that means you would lose that money or not, but irregardless, getting signed up for Part A and Part B is really important to avoid the late enrollment penalties.
I mean, they may have said you don't need Medicare because you have health insurance, right? And you can defer Part B, but your health savings account should be a savings account, whether you use it for health or not. Okay, let's talk about this. This person says, if a person has an Advantage plan instead of original Medicare, will the donut hole disappear with those plans?
Yes.
Absolutely, yes. Yes.
Okay. My husband's Social Security check is several $100s more than mine, but my Medicare premium is the same as his. Is there any possibility that my premium could be reduced?
No, not if it's around 174.70, because that's the entry point. The majority of people, that's what they pay per month for their Medicare Part B is 174.70. Now, we mentioned in an earlier segment, Catherine did, if you're a really low income earner, you might be able to get help from Medicaid with that. But 174.70 is the starting point. So most everybody is paying that unless they're a high income earner, and then they're paying more.
If you look on the North Carolina Department of Insurance under their SHIP program, they speak to that very clearly, and that's NC Department of Insurance, SHIIP.
2 I's in SHIP. Okay.
2 I's in SHIP.
This person says, I was not aware that I had to sign up for Part A. I am still employed and have insurance. I turned 65 in November of 22. Is there anything I can do to lessen those penalties?
Probably not. I don't know. They don't mention if they signed up for B. They just said A.
Either way, it does not sound good.
Call Social Security.
Okay, really quick. I just received my Medicare card. When should I sign up for supplemental insurance?
Now. I mean, when you just have Medicare, you have to understand Part A is pretty much 100% coverage other than an annual deductible for hospitalization. But Part B is generally only 80% coverage, which means you owe 20%, and that 20% never maxes out. It keeps on and on going. So you need supplemental insurance to cushion the blow of that 20%.
Okay, and this person is a teacher turning 65 in October. I'm still going to be working. I missed the beginning of the show. When should I enroll in Medicare? Catherine, quickly.
3 months before, so you're coming right up onto that to 3 months after. So once you hit that 3 months before your birthday, go for it.
Okay, you need to sign up for all the parts and defer Part B. That's what you need to do, teacher. We wanted to make sure we got your question done. All right, thanks so much, guys, for your time and your expertise. If you missed any of this, this is going to be in the Two Wants to Know section.